When March of 2020 came around, it undoubtedly changed an aspect of everyone's life. And for everyone, the version of themselves 3 years ago would not recognize the person they are today. The pandemic made a lot of people undergo self reflection, and for many students especially, they noticed a big change in study habits and trying to navigate the adjustment from in person to online school. One of the most noticeable changes is that many students tended to procrastinate more than usual, and that it was hard to establish a routine. Many students likely questioned why they suddenly lost the strong work ethic they had in high school, thinking, I used to be so productive and had no problem getting up and doing my homework. Why can't I simply seem to get out of bed now? It's normal to have unproductive days, and burnout is something that everyone is able to experience. But if you're wondering if it might be something more, then we're here to help demystify and explain ADHD and anxiety, two conditions that have symptoms that can be relatable to many people. So we're here to outline the differences between each condition and to help clarify any doubts that you may have about them.
So, ADHD is actually an acronym which stands for Attention Deficient Hyperactivity Disorder. This is a disorder that is mainly inherited and affects mostly the brains of young children and continues in adulthood. Specifically, the brain's executive functions are impacted, which can be seen as having trouble focusing and organizing one's thoughts. Now, there is no specific test that is administered to test for ADHD. However, doctors can narrow down the symptoms to ADHD by first conducting a full physical examination to rule out other diseases. Then, the doctor can conduct a series of interviews with the suspected ADHD patient where the patient's cognitive ability can be assessed, and at the same time, the doctor can learn more about the symptoms. Also, there are many ADHD rating scales such as the Connor scale, the behavior assessment for children, and the adult ADHD clinical diagnostic scale, which all help the doctor assess for symptoms such as hyperactivity, impulsiveness, having difficulty paying attention, emotional problems, and more. Doctors can also provide checklists to teachers, parents, life partners, guardians, and other significant people in the patient's life that can provide valuable insight on how that individual behaves in their daily lives. Currently, treatment for this neurodevelopmental condition includes medications that can improve some of the symptoms that we'll discuss in a short bit, behavior therapy to improve the child's social skills, for example, and parents and teachers being instructed to provide positive feedback to the child's behaviors. Now, establishing coping mechanisms for ADHD is critical because if left untreated, it can lead to other conditions such as depression, low self esteem, and increased risk taking behavior, to name a few. On the other hand, anxiety is a condition that can affect really anyone. Anxiety is described as a condition where someone is feeling very scared, experiencing uneasiness, headaches, difficulty concentrating, or just being worrisome of everyday situations. Now, anxiety can be seen in two ways, where the first is just being stressed out about a particular task, such as writing the MCAT or going for a job interview, but post task, the anxiety goes away. However, if anxiety remains for a minimum of 6 months, then you likely have an anxiety disorder. To diagnose an anxiety disorder, several mental health tests and psychological surveys are conducted for the doctor to understand and see the extent to which you're experiencing anxiety. To treat anxiety disorders, medications such as anti anxiety pills can be prescribed, and stress management techniques can be recommended, such as yoga or meditation.
Similarly, a lot of people with ADHD, autism, bipolar disorder, and other neurodivergent conditions face a symptom called executive dysfunction. The ability to get started, organized, and sustain motivation and effort on a task is severely impacted and becomes more overwhelming than usual. This doesn't indicate that the person is sluggish or lazy, because there is a deep desire to simply start the task, but it's almost impossible to move forward and make progress. It feels as though you're paralyzed in one spot while thinking about all the stuff you have to do the whole time.
Generalized anxiety disorder is a mental health condition that causes fear, worry, and a persistent sense of being overwhelmed. It is distinguished by excessive, persistent, and unreasonable concern about everyday things. Physical symptoms like shortness of breath, panic attacks, nausea, and stomach pains can also occur as an internal response to anxiety. On the other hand, Burnout is a psychological syndrome emerging as a prolonged response to chronic interpersonal stressors. The three key dimensions are overwhelming exhaustion, feelings of cynicism and detachment, and a sense of ineffectiveness and lack of accomplishment.
ADHD is a psychiatric condition which shows patterns of developmentally inappropriate levels of inattentiveness, hyperactivity, and impulsivity. The symptoms usually begin young and include lack of attention, lack of concentration, disorganization, difficulty completing tasks, being forgetful, and losing things. Although burnout, ADHD, and anxiety can be similar, they are different and robust constructs.
So, how exactly does the pandemic cause burnout in people? It begins with the loss of connection to social interactions, which causes one to have excitement and look forward to new experiences, and life feels more within your control. Without proper human interaction, you feel disconnected from reality, and since so much time has passed, you don't know if the things you used to find enjoyable before the pandemic are the same, since you're pretty much left alone to figure out what you genuinely find meaningful for you. With that being said, working and trying to do school and other tasks can become challenging because of the ongoing feeling of not knowing when the pandemic will end, and it's a constant cycle. Burnout has also increased in different professions and industries, like the healthcare industry as the most popular one because of longer working hours and increased demands from the job. All of these factors combined with the huge adjustment of lifestyle changes due to the pandemic causes burnout. To conclude our video, there are many similarities between the symptoms of burnout, ADHD, and anxiety. While we try to highlight the differences, the best way to approach the uncertainty is to seek professional assistance to identify if you do have more than just burnout. As a university student, you can visit your school's wellness center to get tested for ADHD or anxiety. Here is an example of McMaster's forms. If you find that many of these questions resonate with your lifestyle, then it's probably a good time to consider getting tested. Generally, the most important thing to consider is that for ADHD and anxiety, these are neurodevelopmental conditions that have actual differences in the brain compared to neurotypical people who do not have these differences put in place to influence their behavior, even if they try their best to cope with stressors. Whereas for burnout, once the stressors and external factors are taken care of and managed efficiently, a person's behavior can slowly become more regulated.